Please maintain silence. Today's lecture will be history taking. It has been switched with the other lecture. My name is Dr. Kunal Rajput. During my lecture, I want complete silence. I don't want any giggling nor any talking during my lecture. I see a lot of you not wearing any tie. Every guy in this auditorium should be wearing a tie. Okay? And I want the girls appropriately dressed, no revealing clothes here. You are a professional medical student now. Okay, this lecture won't be provided to you online, so take as many notes. Get out a sheet of paper, take down notes. Can you guys see me there? You guys want to shift here? No, are you okay? Okay. You want to sit down, is that okay? Okay. Take down as much as you can.
Just write on the phone and me.
You there, where are your notes? Why have you come to my lecture without any notes? Take a sheet of paper from him. Where's your bag? Okay, take it from her. Okay, so let's start. History taking is a very vital component of your medical career. You will be doing this all throughout your life. We'll be teaching you in IMU. This will be there in your examination, so please pay attention. Throughout the lecture, I will be asking you questions. So do not talk and do not distract the class, because trust me, I am not hesitant to kick you out. Okay. So history taking, also called medical interviewing. You will be interviewing patients in IMU. These patients will be simulated. What I mean by that is, these patients will be trained and will act out their disease, but don't actually have it. But trust me, they're very good actors. They have been working with IMU for the last 15 years. So they are good actors. So I want you to treat them as real patients and not as actors. It marks the start of your medical intervention. So the first hello as well would be the start of the medical interview. Okay, medical, as it's written there, history taking makes up 70% of the diagnosis. Hello? Are you late? You're late to my lecture, it's already 10 minutes gone. And you have that coffee in your hand, doesn't it say clearly outside? Not to get any drinks or any food in the auditorium. I want you to enter from the back and throw that coffee away, please. I don't want to see it again. Okay, so where was I? Now, move on now. Okay, so history taking. I personally hate these two words. Because you're not actually taking the history from the patient, are you? You're not taking the history, you're taking the past, the present, as well as the future. And you're taking the patient's concerns, his expectations, and his worries into consideration. That's how you treat your diagnosis. That's how you treat the patient. You don't just take the past from the patient. So what you're actually doing is, you're taking the patient's story, you're taking his story. Next, the second word, taking. You can't take anything from the patient. You can take blood from the patient, for instance, but you can't take the history. The patient is willingly giving you the information. You see that, you guys keep talking. This is not a professional behavior, and I won't handle this in my lecture. I want you guys to shut up right now. It is very distracting, and you're sitting right in front of me. Next time, there will be severe consequences. You understand that? Okay. Yes. Okay, so why don't you guys come down and sit with these? Is that okay? Sit with the others here. I'm sorry about that. From next time, you guys should sit on that side, because that one's that area is a little bigger than this side, so you all might fit there. Okay, quick now. So as I was saying, you're not taking anything from the patient. The patient is actually willingly giving you the information. You want to have a formal conversation with the patient rather than an informal. You don't want to have an informal tone. You don't want to be robotic. What I mean by that is a lot of students, when they're nervous, they tend to not show emotion. So as in, for example, when the patient tells you his mother's died, won't you normally feel sorry? You would. But patients, the students sometimes say thank you. It doesn't really make sense, does it? And the lecturer observing just doesn't seem to know what the student is doing. Also, I want you to build a relationship with the patient. This helps the patient to open up to you. It makes the patient more comfortable and the patient will give you vital information. A secret in IMU though, if you talk and if you're confident during your history taking, the simulated patient will give you a lot of information without you asking him. Okay, next. Now, so as I said, you are gathering information. You're not taking information from the patient. This semester, you will be gathering information only, but as your medical career moves along, you will be dealing mostly with patient management and negotiating skills and treating the patient. Okay, so what we're doing is we're talking about the patient's concerns. We want to know more about that. We want to know about the patient's worries, the patient's life story, basically, within the 5 minutes that you have during your history taking. So you will have, sorry, I forgot to say this though, but you will have 5 minutes during your examination to take your history. You will have to talk to the patient, take the whole life story during the 5 minutes. It's very difficult and does not come easily, so you have to do a lot of practice. Next, you will have to summarize. Within the 5 minutes, you will also have to summarize to a medical professional, and also you will have to probably come up with a few differential diagnoses. Okay, so questioning skills. Now I will be showing you a few questions which will help you out during your interviewing. These questions, or these type of questions, basically two being the open-ended and the close-ended questions, will help you out during your interview. I want you to use them as templates and not as strict questions. Okay, so open-ended questions. These questions are best used at the start of the interview. At IMU or in any other medical university, you will be recommended to use open-ended questions more than the close-ended questions. The open-ended question would basically be something like, what has happened to you, Mr. Tan, or how are you today? This allows the patient to speak a lot more about his life rather than you asking him closed questions. Closed questions are basically, as I will go to it later, are questions which make the patient give you a one-word answer, which you don't want in the start of the interview. You want to gain as much information as you can and then move along to the one-word answers, which will make you reach the specific diagnosis. Okay, so it also encourages the patient to speak more. A question such as, can you tell me more about that? If the patient comes in with cough, and then you ask the patient, could you tell me more about the cough, please? So that encourages this patient to speak more. And sometimes also lets the patient know that you are listening and you're taking the patient's considerations into your... Okay, these are just a few examples of open-ended questions. Next, close-ended questions. Close-ended questions are valuable for defining purposes and establishing definite events. You receive specific information. So if you want a yes or no answer, or if you want a one-word answer, you would use close-ended questions, such as, was there any headache? So the patient will only answer in a yes or a no. Okay, and then you can also narrow down your diagnosis. So at the end or in the middle of your interview, you would use close-ended questions, right, to come up to a specific diagnosis and help you out. There's a very thin line between balancing these two components of asking questions, which you will learn with a lot of practice. Okay, so components of history taking. Okay, now, you guys have been talking for so long now. It is very distracting. And you're distracting the whole class. You're not even dressed right. You know, come here, get up, come here. Come here, stand here, come here. Quick! Okay, what's your name?
Wait, yeah.
Okay, what are you doing here?
Listening to a lecture.
Okay. Are you studying medicine here?
Yes.
Okay, so do you want to act as a professional and not as you're still in high school? Because you're not, you're in university now. You want to be dressed right. Come here, come here, come here. You see how he's dressed? He's dressed in the proper attire. You're not. This is not how you dress here. Okay? Go sit back down. Thank you. Next time we talk, I will take you to the dean's office with me and the dean will handle with you then. Okay, so components. These components are to guide you through the history so that you take the complete history. I don't want you to miss out any components from these, but at the same time, I don't want you to be using all the components every time. With experience, it will come to you. You will know when to use which component from these different components guide to master history taking. Okay. So the first one will be introduction. You would greet the patient. You would say hello to the patient. You would introduce yourself. And then you would explain your purpose, what you are doing there. You're taking an interview. So explain that. What are you going to do? You're going to after that, summarize to a medical professional. And then you're going to come up with a diagnosis. So explain that to the patient. Then you're going to take permission from the patient. This is very important. This you have to do all the time. You want to take consent from the patient every time you are doing your history taking. Consent would be a simple verbal question such as, do I have your permission to continue? Okay, demographics. You want to confirm the name of the patient. You want to confirm the age of the patient to know that you're interviewing the correct patient. You don't want to be interviewing someone you're not. And in the ward, in the hospitals, you will have many patients. You don't know which one you're interviewing when. Okay, so the chief complaint. This is what the patient comes in with. The patient will come in with headache, or with sore throat, or with a heartburn. That's your chief complaint. The patient's worry is heartburn, so you want to treat the heartburn. You want to ask about the heartburn. So the chief complaint is what you should ask about the most. Out of the 5 minutes, at least 2 minutes should be about your chief complaint. Okay, it is the most important component, as I've said. You want to ask open-ended questions because you barely know anything about the patient. You don't know what the patient has come up with. So you want to ask him open-ended questions so that the patient gets time to talk about. Socrates, an acronym which will help you out to ask relevant questions. Write this down, this is very important. The site, the onset, when it starts, character, how it feels. It might feel thrushing as in during a myocardial infarction, or it might be a sharp pain due to pleuritic pain in the lung. Next would be radiation. In myocardial infarction, as most of you would know, myocardial infarction is actually heart attack if you guys don't know. Heart attack, the pain would radiate through your left arm. So that's radiation. And then there would be associated symptoms. You there, you're late in my lecture. You're late by 20 minutes. Do you know that?
No, I wasn't aware.
You weren't aware of that. You don't know what time the lecture is? What were you doing? No, I don't want your explanation. What were you doing now?
Sorry, I was having my breakfast.
Oh wow, you were having your breakfast. Was it good? Okay, that was good. Now get out of my class. I don't want to see you again here. Go get out of my class. I don't want to listen to anything. Go. Turn around, open the door, and get out. Okay, so let's continue. Yes. No, he was aware. He was aware. He knows there's a classes now. There's an 8:30 class in the timetable. We have updated the timetable of the e-learning. You want to go and look at that.
I paid for my attendance.
Doesn't matter. I don't care. You're late. If you paid for your attendance, you should be on time. Go. This is a professional medical university. I don't want you to be late like this boy ever again.
What if I don't leave?
What if you don't leave? I'm not going to continue the lecture. Yes.
Sorry, yesterday someone came in and told us that your lecture is at 10 and not at 8:30.
No, it has been changed in the e-learning portal. Oh, you have it. So, sorry then about that. I don't know. That's to be handled by the IT department. They tell me when the lecture is and I come here and give the lecture. I don't really know about all of that. You should probably go to the IT department and complain about that. I don't really know about this. They tell me when the lecture is and I come here and do my job. Okay, so you guys have had a lecture before this, haven't you? Yeah? Yes, so you guys should be here then after that. Why is he still in? You're still here? This boy doesn't want to listen to me. Hey you, listen, get up. Stand up. Stand up, come on, listen to me. That's you, yeah. Ask him to stand up. Stand up. Don't look at me that way. You can hear me, right? There's speakers everywhere.
It's not professional, just continue like, keep on telling us to be professional. It's not professional behavior.
This is if you say I'm being childish. Coming 20 minutes late is being childish. In the ward, in the emergency department, a patient is dying on the table and you're 20 minutes late, the patient is going to die within the 20 minutes. This is not how we work in hospitals. This is where we teach you how to be doctors, okay? That is childish behavior. I'm going to continue. You meet me at the dean's office after this. Okay. Let's continue now. I want you to avoid medical jargon throughout the interview. Do not use medical words to the patient. The patient does not understand that. The patient is not a medical student. Yes. Are you done writing it down? The distraction. Okay, so radiation. Radiation would be, was that radiation? Yes, I was right. Okay, so radiation would be in a heart attack. In a heart attack, the pain would radiate to the left arm. So that's radiation, so you want to ask about that. That's very important. Next would be associated symptoms. Associated symptoms include symptoms such as headache or vomiting with something like a myocardial infarction, or joint pain probably, or something like that, not related to the presenting complaint. Next would be timing. When the pain occurs during the day, or when the pain is most felt during the day. That's timing. Next, the exacerbating and alleviating factors. The relieving factors, because patients usually have something they do at home which makes them relieve the factor. Something for sore throat probably, so they use relieving factors. And then there are some things which make the pain worse. So you want to ask about this. These are essential information which will help you diagnose the patient. Next would be severity. So if a patient comes to you with heart attack, you would ask the patient how much the pain is. What I mean by how much the pain is, you want to give the patient a scale from 1 to 10. 10 being the highest. So that would give you a reading of how much the patient is actually feeling the pain. Okay, the past medical history. The past medical history is basically very easy. It's the past medical history. So what the patient has been through in the past, if the patient has had the same disease in the past, yes, and if the patient has had any serious surgeries, which would then present as this complaint. Okay, family history. Sometimes diseases are run down in the family. They're inherited, as we know, as we've learned, as you guys have learned in your high school. So you want to ask how the parents are. If the parents are okay, you want to ask how the grandparents are, if they're still alive. If they're not alive, how they passed away. You want to know that these are vital information as well. Okay, social history. Social history would be how the patient lives. I bet all of you all know what social means. So it's about the social life. So the living arrangement, the occupation, marital status, number of children, drug use, and recent foreign travel. For example, if you ask if the patient is presenting with malaria, he's probably been to a tropical country. So you want to ask about travel. Or if the patient has pets, he might present with asthma due to allergy to these pets. Moving on, drug history. Drug history would include if the patient has taken any medication, if the patient is on any regular medication, or if the patient is allergic to any medication. Okay, so lastly, review of systems. Review of systems is very important as well. Whose phone is that? Don't do that next time, okay? Put it on silent now. Review of systems. So you want to review other systems other than the one which is presenting to you. So if the patient is coming in with heart attack, that's cardiovascular system. You want to ask questions from different systems, such as respiratory or nervous, to get to a better diagnosis. Okay, now, thank you. for attending the lecture. Now, as we have time, I will be calling two of y'all to present a perfect history taking, because all of y'all have listened to the lecture now and have learned a lot. Okay, so who would volunteer to come up? Who wants to come up here? Okay, you two talking there. Come. Show me how history taking is done. Probably because you guys have paid a lot of attention in my class, haven't you? Now come, show me how history taking is done. Yes, you two right there. Don't be here. Come. Get up. You guys have chairs? Well, that's okay, you can stand up. Okay, so this is how the scenario will be. There will be a patient, such as him. What's your name?
Jiang.
Okay, so the patient is Jiang, and what's your name?
Wei-Xiang.
So Wei Xiang is the medical interviewer. Okay? So, and I'll be the observer. So this is how it's going to be in an examination. You will have 5 minutes. You will be given a case, and you will have to go up and present your history. Okay. So the case is abdomen pain, stomach ache. Okay? So start now.
Stomach pain. Take off your shirt.
Why would you take off a shirt? Does that make any sense to you? During a medical interview, you want to take off the shirt. What do you want to do with it?
Examine.
You want to examine him? This is interviewing. You don't want to touch him. You don't want to feel him. You just want to take his history, verbal, okay?
Hi, I'm Dr. Yeo. I will be a doctor today.
You're a doctor. On your first day to medical school, you're already a doctor, are you now? No? Then why would you tell him you're a doctor? What are you?
Medical student.
Okay. So you're a first year medical student. Tell him that.
Hi, I'm a first year medical student. And
Okay, let me help you out. Hold on. Okay, go.
I'm here to take your history.
Are you not sure you're about to take the history?
I am here to take your history. Do I have your permission?
Yes.
Okay. What's your name?
Jiang,
Age?
20.
Sex?
What does that mean? Would you want to ask him if he's had sex today? Is that what that means there? What does that mean then? What does that mean?
Sexual history?
No, that does not mean sexual history. That means his gender. Don't laugh, don't laugh. Shh, don't laugh. We're teaching here, okay? You want to ask him his gender.
What's your gender? Okay.
Okay. Right now you ask him his gender, but you would probably know what he is, okay? You can see that he's male, can't you? Okay, good. Turn around, face the class, come here. Face the class, okay, good. Okay, go. Next. Forget about it.
What's wrong with you?
I got stomach ache.
Where's the pain?
Stomach.
Of course the pain is in the stomach. How did you get into medical school? When he says he has stomach ache, where is the pain? Where's the pain when he has stomach ache? Show it them.
Just stomach.
Yeah, that's the stomach, right? Don't you know that already? Didn't they teach you that in high school? How did such students get into medical school? How did you get into medical school?
I got good grades.
Yeah, you got good grades, but it's more than good grades. It's about how you talk. You're going to be a doctor. Doctor is a talking profession. You're not going to write exams there in the hospital. Okay? Go ahead.
When did the pain start?
Just now.
Just now. The case started just now. When you saw him. Okay, the pain started a week. So go ahead.
Okay, pain started. is it pen? Is it pen? Oh, how pen is the pen?
Clearly, you weren't paying any attention in my class. You haven't got any information down from the class. I want you to take down someone's notes and learn from them. Okay? You can just give him your notes after the lecture. Okay? Just photocopy them and learn from them. Okay? You're here to be a professional. Please do not disappoint us every day, every day. Okay? Go sit back down. Sit back down. Okay. So now I'm going to, after this very amazing history taking here, I'm going to present to you a proper video about the history. This will teach you how to give the history correctly. You just find it now. Okay. Oh, we can't hear this now. What about that? Don't leave the lecture. Why are you leaving the lecture? Sit back down. No, sit back down now. Where are you running away? You want to pee? Are you so scared about them? Okay, go. These are actually your seniors here. Okay, hold on, let me move the mic. Can you call someone? Can you call someone? Sorry about this, the video is just taking some problem. This happens quite a lot.
They copied our lecture.
Basically, what I said in this video, sorry, the volume's not working. But what I said is, we're both your seniors, as he said. We're batchmates. Everyone who was doing the Harlem Shake just now are all batchmates. And the lecture he delivered just now, it's not what orientation is about at all. I really encourage you guys, have fun for these 2 weeks. Okay, enjoy the activities fully. You will honestly regret missing them, so please don't. We put a lot of, our batches put a lot of effort in, so do your best to attend them. Of course, medical school, you have to take it seriously, okay? It's important to find a balance, be professional and all, but don't kill yourself over it. Do enjoy your time here, okay? And now I'm just going to, well, without further ado, we'd just like to introduce our orientation committee now.
How they tell her face?
how was the fake lecture?
Awesome!
Sorry to tell you, the lecture was not the real one. So we took down notes. Screw the notes. Right now. Welcome to IMU again. You guys saw me yesterday. And yeah, welcome to IMU. And just now, all the crowds, those who shake themselves, identify yourselves. Yeah, we're all behind there. There's some outside. Yeah, we are all from ME 112. We are sentries now. Oh, sorry, DT also, dentistry also. And Dr. Kunal Rajput over here. He's not a doctor, okay? He's our best as well. And Rahul over here. Okay, so this is the launch of the orientation for 2 weeks. Okay, so you're gonna see us a lot throughout these 2 weeks, and we will introduce ourselves live right now. So, I'm Dalton again, the president.
I'm Lynette, the other vice president. I'm Amanda, secretary. Elaine, secretary.
Emily,
Zuyen,
the treasurer.
Kailin, chief event manager. Cherise, chief design. Joyce, chief OO.